The work of global health innovators will be critical in addressing the devastating ripple effects of COVID-19. But for those whose work is not directly connected with the pandemic, it's been more challenging than ever to raise money, form partnerships, and continue, let alone scale their work. So, what kinds of approaches have succeeded over the past 2 years despite these constraints? Joining us to discuss their work to advance progress on other health priorities in the context of COVID-19, we have Steve Adudans. He's the founder and CEO of Gear Health Systems. And his background includes work on medical oxygen as CEO of Hiwatele, as well as work on maternal, newborn, and child health, most recently as Kenya Country Director for Nest 360. We're also joined by Dr. Nithya Ramanathan. Hey, Steve. She's co-founder and CEO of Nexleaf Analytics, which is a nonprofit technology company that uses sensor data to provide countries with the information they need to improve the health of people for all medical equipment across the health system. And Pradeep Kakkattil, he's the director of the Office of Innovation at UNAIDS. He's also the co-founder of the Health Innovation Exchange, which is a platform for connecting governments, policymakers, innovators, and investors around technological innovations to scale up access to health. And finally, Dr. Kesete Admasu. He is the CEO of Big Win Philanthropy, which is a foundation that partners with African leaders to improve young people's lives. Dr. Admasu is also a board member at the End Fund, which is a private philanthropic initiative to combat the 5 most neglected tropical diseases. And since serving as Ethiopia's Minister of Health, a perspective I'm really grateful we have on this panel, he's worked in a number of prominent positions, including serving as CEO of the RBM Partnership to End Malaria and bringing his experience to a range of regional and international organizations in the health sector. Before I dive into questions, with many thanks to these great panelists for joining us, I do want to mention something you may have heard earlier if you've been with us since this morning. We do have an illustrator joining us to capture some of the themes of our discussion. And here's a glimpse at the blank canvas we will be filling out with all these brilliant ideas. We'll revisit that illustration toward the end of our conversation. So thanks again to our panelists for joining us. And diving right in, really at the heart of this conversation is the fact that COVID-19 has been hugely disruptive across global health priorities. And I want to hear from each of you, what has the COVID-19 pandemic meant for your work, and how have you worked, perhaps through partnerships, to overcome some of these challenges over the past 2 years? Maybe we'll start with you, Steve.
Yeah, thanks, Catherine. I mean, as you know, COVID-19 has made it very, very challenging, especially for healthcare workers, especially in sub-Saharan Africa, where I work in Nairobi, Kenya. And we never thought actually we would actually realize that health is a human right, because patients were affected whether they're rich or poor, so they needed the help they needed because of the COVID-19. And we realized actually a lot of the prevention efforts were based on community efforts, and this is things like social distancing and also hand washing. These are basic sanitization and priorities that actually helps to prevent infections. And one of the things that for me, working in the medical oxygen space back then, is that I see what I call a digital divide, which is more like a double-edged sword. Why do I say that? Is because on one hand, medical oxygen got a lot of attention and what I would call digits in terms of dollars. More dollars went into COVID-19 in terms of oxygen systems, human resources to support, delivering care for patients, and even commodities. This meant that maternal and newborn health priorities were put on the backside. A lot of women and children actually never went to hospital. Why? Because a lot more patients were even dying in the hospital. So there was that stigma that facilities were associated with death. So in a sense, I think this was a major challenge that I saw, and we tried to find out how do we ensure that actually patients get the right information, that hospitals are still the safest place to go. Now, the other side of the sword actually is that there is an opportunity for digital integration, and this is where we see that most people actually went back to their phones, and a lot of information are coming through phones, and what I would call actually a mobile phone pandemic in Africa. There are more phones actually. You'd find that one person having almost 2 to 3 phones. So people had access to a lot of information, and they're able to query that information. But now we have to see, how do they get that information right?
Yeah.
And that's why I'm wondering, how do we ensure that most patients who died during the COVID pandemic were suffering from NCDs? And at Gear Health Systems, what we're looking into, how do we ensure that patients get the right information, the right products, disrupting those barriers so that they're able to get the right products and information? Over to you, Catherine.
Thanks, Steve. Yeah, and I'm glad you highlighted some of your work in maternal and newborn health and some of the impacts in that space. Again, an example of where the impacts of COVID have been pretty devastating for maternal and newborn health. And yet, for those who are working on the very innovations needed, it's been really hard to, as I mentioned, raise money, form partnerships, scale their work, because a lot of the funding is going to COVID-19. So I'm really excited to follow what you're doing with Gear Health Systems as well. I want to go to Nithya now because, in terms of the devastating impacts of COVID-19 across many areas you're focused on, there's also been a lot of innovation in things like, vaccine cold chain storage, because that's a huge priority. And that's something Nexleaf Analytics has worked on. So I wonder, how have you leaned into COVID-19 response while also continuing with other applications of your technology?
Yeah, thanks, Catherine. One of the things that we've seen is that in COVID, there's been this space to dig deeper, go to root causes. I think one amazing example of that is actually local vaccine manufacturing on the continent in Africa. So a real opportunity actually for people to think bigger, actually break silos. And so along those lines, just building actually on what Steve was saying about that digital divide, what we've seen is that health workers actually are kind of the next generation tech workers. There's so many innovations. There's so many different solutions coming up. And in the past, I'd say everything was really siloed. You had malaria money going to malaria solutions, vaccine money going to vaccine solutions. But increasingly in this moment to think about root causes, the very natural solution is more integrated. So let's not have duplicate supply chains. Let's actually integrate the supply chains. Let's integrate the refrigeration. And so along those lines, actually what we've seen is that with better data, ministries of health have been able to make investments more confidently in more integrated ways. And so one concrete example we're seeing is, rather than thinking about electricity for health centers, just electricity for one vaccine fridge, we're seeing more that we're able to actually, with sensors, measure the amount and the quality of electricity across an entire health center, and then actually use that information to inform more integrated thinking about the infrastructure and equipment supporting health at this time.
Thanks, Nithya. And speaking of more integrated thinking, I want to go to Pradeep now. And Pradeep, I'd love to hear from you both with your UNAIDS hat on, but also the work I mentioned earlier in terms of the Health Innovation Exchange, because it sounds like the integration Nithya talked about is what that's what it's all about. So can you tell us more about what the past 2 years have meant for you? I mean, certainly the work of UNAIDS has been affected by COVID-19, so I'd love to hear how you've overcome those challenges.
Thanks very much, Catherine. Let me start with what COVID has done for the AIDS response. We have seen significant impact when it comes to prevention. About 10 to 15% of the young people who need to have access to prevention, there's been a decline in that. We are seeing major challenges in terms of supply chain and access to antiretrovirals. We are also seeing, as the systems are getting overloaded with COVID response, the time that is available for responding to HIV and TB and malaria and other diseases, and as Steve already mentioned, NCDs, that's being missed out. So there's a huge challenge on that front. I think in terms of adoption of technologies and innovation, the openness with which countries are embracing innovations, the ability, telemedicine is a classic case. It has taken us so many years to embrace it, but now during COVID, countries have been able to change policy, provide the space for taking that on. use of artificial intelligence. I mean, again, the way we have been working really is to, I'll give you a couple of examples. We had been working pre-COVID. I can't even remember what that looked like, but pre-COVID, we had been working on tuberculosis diagnosis using artificial intelligence. When COVID came, we really helped to repurpose that and see whether that could be used for diagnosing COVID. And the team that we were working with were in China. They were the first ones to use AI for COVID diagnosis, and we were able to fast track that. The same thing, we had been working on antimicrobial resistance, and they've come up with a fantastic solution which works in reducing the presence of coronavirus on surfaces and in the air. So what I believe what COVID has done is it has challenged all of us to think differently, and to also, as Nithya has already said, the need for integrating and bringing the pieces together. Unfortunately, that's not going far enough. That reform needs to happen, and I would blame the people from the health community for not really thinking big and really thinking short term, really looking at, okay, what can we do today? What will happen if we don't? And for me, coming from the AIDS movement, HIV really helped us in the early days to rethink health systems 2.0. Now, with COVID, if we do not use this attention and opportunity to go to health systems 3.0, we will win, potentially, maybe we will win the battle against COVID, but we will lose the long-term access to healthcare, that war. I think it is really imperative to move towards that now, and we are not thinking big enough. That's my challenge there.
Thank you, Pradeep. And just quickly, because I want to get to Dr. Admasu here, but in terms of the Health Innovation Exchange and the role that can play, I mean, I guess that's part of the goal, but perhaps more is needed. So can you just quickly touch on where you are with that and what more is needed to really build those connections that are needed?
Thank you. Health Innovation Exchange, what we really try and do is to work with countries on their pain points. What are they struggling with? Because there are so many innovations out there, and the people who can really adopt those innovations and scale it are not the ones who seem to be aware of it. Most of us sitting in Geneva and Seattle and other people seem to know, but the minister who is responsible for it in a country is not getting to see that. So what we do is we work on pain points, we bring in the different solutions that can actually find a way to help scale access to healthcare. And the third piece of that puzzle is really, and again, when I say bring the solution, some of it can range from energy solutions, because if 50 to 70% of health facilities in several countries don't have access to stable energy, then cold chain, your ability to provide basic health services is not working. So we try and think outside the health sector, because I believe that if you want to have impact on health sector, many of the solutions lie outside. That's where Health Innovation Exchange brings them. And then we also have the third leg, which is the investments, because again, if you look at Africa for innovations, less than 0.5% of the entire PE funding and the VC funding went to Africa for for innovations, and within that, health is a very small part, and that's just not acceptable. So how do you bring new resources, not just donor funding, but investment resources to scaling innovations in Africa? So that's what the Health Innovation Exchange tries to bring, those three: the innovators, the countries, and investment. So that's what we have been doing in several countries.
Thank you, Pradeep. And Dr. Admasu, I'd be curious to hear your reaction to the need for something like this, given your former role as a Minister of Health. But first, I want to just ask you, Pradeep was just mentioning how solutions outside the health sector matter for the health sector. And that gets to some of the priorities of Big Win Philanthropy. So Big Win Philanthropy, as I mentioned earlier, focuses on young people. And I know your portfolio includes work on nutrition, early childhood development, education. All of these areas were hugely impacted by the pandemic, and they all matter when it comes to health. So I wonder if you can talk about the impacts of COVID on the work that Big Win Philanthropy does, and how you've worked to counteract those challenges, maybe even drawing on some of some of the lessons from your time as Minister of Health and your work today.
Thank you, Catherine. Glad to be here. I think, one of the key lessons we can take is how important and impactful leadership is. You can't do only one thing at a time. That was, I think, the focus with regards to COVID-19. During this difficult time, we have seen how investing in leadership, investing in multi-sectoral coordination over time has paid off, and it has allowed us to really bring different sectors together to address multitude of issues. If I take the example of neglected tropical disease that affects 2 billion people, initially case finding has been disrupted. Mass drug administration was stopped. But at the same time, there has been a lot of investment in bringing the wash sector, for instance, the water and sanitation, and the community actors together to, deliver on preventive and treatment services. So I think during the COVID-19 period, the end fund partners have come together to really provide, the WASH, NTD, as well as COVID prevention services. But at the same time, we were able to administer 757 million treatments in 2020. Again, at the same time, emphasizing the importance of leadership. In my own country, in Ethiopia, they have developed a sustainability framework and a strategic plan to defeat NTD over, the past few months. This has shown the commitment of the government and the leadership there to have an NTD-free world. So it means there are, a lot of commitments and priorities that need to be addressed. At the same time, the NTD community has also worked on, securing commitments through the Kigali Declaration. The London Declaration on TB, as well as the Addis Ababa Commitment, which was signed off when I was a minister. These are, important moments that really secure and garner support from government players. So most of our issues, the development issues we work with, really require, strong, genuine cross-sectoral collaboration. And this genuine cross-sectoral collaboration does not work when you go with, a cooked solution. You need a genuine collaboration, means people come together and discuss how do we, particularly as government leaders and partners that work on a lot of priority issues, work together. How do we prioritize, sequence? Where do we bring synergy in our work? So I think this is an important lesson that we have learned through my work in Big Win as well as
Dr. Admasu, this is more with your donor hat on, your philanthropist hat on as CEO of Big Win Philanthropy. And I'm sure you dealt with a lot of different foundations and donors in your time as Minister of Health. Oftentimes, funders can be part of the problem when it comes to these global health silos that we've all outlined are problematic, right? Because funders have priorities and they want to fund those priorities. So when we talk about getting to the genuine cross-sectoral collaboration you mentioned, funding can sometimes be part of the problem. So a question for you is, how can funding in global health go from part of the problem to part of the solution? And maybe I'll see if any others want to jump in after that.
I think the most direct and genuine answer is to listen to the countries and to listen to the leaders there. They know their countries, they know their priorities, they know what works, what doesn't work. So really listening to them is the best way forward. That is what we do as Big Win. We don't prescribe solutions. We don't, assume that we know what is best for the country. We try to partner with leaders who are genuinely committed to improve the lives of their people and transform their economies and achieve good goals. So I think that honest approach of appreciating and respecting local knowledge, wisdom, and leadership is very important.
Great answer. What do you see as one key element for global health technology and innovation to go to scale in low and middle income countries? So one of the things we talk about at Prescription for Progress is you have a lot of great solutions. They aren't going to scale. Each of you are working on addressing that in different ways. I'll start with Nithya.
Yeah, I love that. And Dr. Admasu's point about listening to ministries, Catherine, you've heard me obsessively kind of talk about how much we need to be listening to ministries of health, listening to countries. One of the things that we've seen is this need for speed. And that's often used as an excuse to bypass government. And so one of the things that I've learned to do is anytime anybody, donor, partner, somebody on my team, anybody says, hey, we don't have time to listen to the government, that is an immediate red flag where we stop everything and we say, no, that is the only thing we have time for. So really strongly agree with Dr. Admasu's point. One of the other things that we've started thinking about is financing. In another conversation, Dr. Admasu, I'd love to ask you more about this, but we've seen that there are opportunities to change the conversations between ministries of health and ministries of finance, to bring in ministries of finance in earlier, more frequently. And so concretely, one of the things we've been doing to support ministries of health is to create more business cases around investments. So it's not about, should I send a technician to fix a fridge, but rather, is it worth spending $100 to protect $50,000 of vaccines? And that's the difference that data has been able to make to inform decision-making and change that conversation around financing.
I love that. Steve, or actually Pradeep,
Yeah.
I see you unmuted. We'll go to you and then we'll close with Steve.
Thanks. It's a great question, and I loved what Dr. Kesete said. But fundamentally, the problem that we have with funders and donors, if I can call them that, is they all seem to be so risk averse that they're willing to fund pilot after pilot after pilot, that you have a pilotitis, but you do not have investments for scale. That is one big challenge, and donors need to really rethink the way they are financing health innovations. The second part of that is that we need to really rethink what the public-private partnerships need to look like and how we can start looking at public financing, de-risking private investments, because the donor funding is just not sufficient. I mean, just to give you the scale, we are talking about what, 150, $160 billion as ODA for overall development, compared to 200 trillion when it comes to the private equity market. So we need to see how we leverage the small amount of money to push the bigger pot of money for investing in healthcare. So if we are not really rethinking financing, we are going to continue to have these pilots and we will not be able to scale. So my call would be really for donors to think differently and to invest and take more risk. I mean, not taking risk is the biggest challenge that we have today. And we have seen with COVID, it was a herd mentality. Every donor shut everything off and then put all the money on COVID. Think systems. I mean, it's great to look at the symptom. COVID is just a symptom of what is wrong with the health system. And if you're not investing in resilient health system, you're all going to put your money around the external visible challenge. We will continue to fail. We'll wait for the next pandemic, and then we'll continue to do the same thing. We'll all wave our flags and say we have done it, but we'll fail. I mean, we'll win the battle, but we have lost the war.
Well put.
Yeah.
Steve, we'll go to you.
What I wanted to say is that there has to be a very strong link between innovation and industry, and this we can leverage on the higher institutions of learning, because a health system building block for human resources for health is a major pillar when it comes to delivery of healthcare. But we constantly have programs where we are having in-service training. So when we do have programs that link the continuum of learning from from the institutions of higher learning to to industry, then we don't have a lot of dollars that are put into all these constant trainings that do happen. So it's a very strong continuum process of innovation and industry and the learning system. Thank you.
Thank you, Steve. I want to go to a question from our audience. I'd love to bring in Neha Agarwal. She's the Global Program Co-Director for Path Diagnostics, where she's responsible for ensuring equitable access for a portfolio of diagnostic products. And she's also on the board of advisors for the Bay Area Global Health Alliance. So Neha, your work has focused on addressing access challenges in low and middle income countries across primary health, infectious diseases, and now COVID-19. So would love to hear quickly any reflections you might have, as well as a final question for our panelists.
Great. Thanks so much, Catherine, for having me. I really love this discussion. And, from my own work and from everything the panelists have talked about, I think Dr. Admasu said it really well when COVID has really allowed us to learn the impact of good leadership and genuine collaboration. And I think we do need to incorporate that moving forward. The Bay Area Global Health Alliance is one great way to kind of catalyze the multi-sectoral partnerships in the Bay Area and beyond. My question for all of you is, as we enter year 3 of the pandemic, how do you wish we act so that we can keep these other global health priorities truly priorities?
I think for me is just 3 main things. One is we need to simplify the science, and how COVID helped us simplify the science. So just washing hands and giving each other some space and all that. Just simplify the science and see how to contextualize it to the setting. That helps the communities respond effectively. Second thing is we need to strengthen the systems block by block. HRH is one of the most affected, blocks. Many healthcare workers got infected with COVID. So how do we strengthen HRH? The last thing is have a sustainable impact, and this is by supporting grassroots-led and nationally led and domestic-led initiatives, because with that, then therefore there is ownership. Thank you.
Taking risks. Really love what Pradeep said about that. Taking risks, and also learning from them. I think we so often talk about how do we learn better, faster, but I don't know that we're actually doing that as much. So how do we get better data, more open conversations, stronger leadership, as Dr. Admasu said? So taking risks and then really authentically learning from those mistakes.
Trust. I think that is something which we have seen across the COVID response, the trust in institutions, trust in our governments, trust in international organizations. We have really paid a huge price. I think there is a diminishing trust that people have. We need to really address that. We need to build that back. Otherwise, we'll continue to have this divide. Number 2 is rights. I do believe that we need to start listening to the citizens and treat them as grown-up, responsible adults. So that's something which we need to do, without which we will probably continue to go into this cycle of lack of trust and not making progress. So I'll stop there.
I would, emphasize the importance of, trust, as Pradeep said, and particularly, the power of, visionary leadership. That's very important. Second, I think related to that is the importance of looking at a new blueprint for development. We talk about breaking silos within the health sector, but we need to look at beyond as well. If one lesson we can take from COVID is, our development challenges are intertwined, and we need to come up with solutions that go beyond the health sector, let alone specific program delivery approach. And the third, and my final lesson would be to really focus on community ownership. Anything that is not owned by communities is not going to be sustained. So you have to create a system that really brings community ownership and individuals to the fore of development agenda.
Thank you, Dr. Admasu. I'd love to revisit that illustration with our limited time, I'm just going to let this visual be the last word. But I want to thank all of our panelists for sharing your time and your insights. And for those joining us live, I hope you'll share some of your own reflections on these questions in the chat, and maybe even make some connections so you can continue the conversation after Prescription for Progress. Thank you.
Thanks so much.
Thank you.